When you're in pain, you're looking for results. Let's say you have a problem with your tooth and you want to fix the pain as soon as possible. When you go to the dentist, you want a result and you want it quickly. Imagine if that dentist sold you a package of sessions to fix the pain slowly over a few sessions. And they would do a little bit of work each time you came in. And at the end of each session, you weren't really sure if anything really happened, if what they were doing was working or not, because you left still in pain. If that was a dentist, you probably wouldn't go back. A dentist fixes the pain, and you don't want to go back there, so they do it in one session, in one visit. And so that's our model with physical pain. You know they've done something. If they've done it right, you feel better. But there seems to be a different model with emotional pain, because studies show that it takes 600 sessions of psychotherapy to get a 38% recovery rate. And I'm not saying you should stop therapy, because I love therapy. I've had a lot of it over the years. It's very helpful. But here's what neuroscience has taught me. Emotional pain travels along the same neural pathways as physical pain. Through something called the insula. It's the part of the brain that's responsible for creating emotional significance from both negative and positive emotions. And Tylenol, acetaminophen, that's the active ingredient in Tylenol. It has effects on both physical and emotional pain. Studies show that it can dull emotional pain in the same way that it dulls physical pain. And studies suggest that acetaminophen has widespread psychological effects. And I don't know if that's a good thing or a bad thing, but what it does show is that it's affecting that same area of the brain. This is what I studied in neuroscience, that common neural pathway that both physical and emotional pain travel through, and then you give it meaning and significance. This research and my experience with my clients, when they connect with their subconscious minds in a deep, resourceful state, has given me a new paradigm of what's possible with emotional pain, so that there's another option, so that you can just add hypnosis. One session, not a package, but one session to whatever it is you're doing to manage your emotional pain. Therapists, as well as people that do hypnosis, focus on sessions. They do a little bit of work every time. You sometimes feel better, but overall, that pain is still there. So when you wake up the next day, or you become present to that emotional pain later on in the same day, it's still there in the intensity. And when it's intense, it probably is very difficult to sit with, to be with. So we push these feelings away, and we suppress them. And they're still there, lurking below the surface. And that's where they live anyway. They live in the subconscious. So talking about it with your conscious mind can make you feel better temporarily, but it's not getting to the root cause. It's not resolving or really changing the intensity of these emotions, because I've been there. You have to go back sometimes later on in the week if you're going through something and your emotions are intense. So you kind of repress them through the week until you can talk about them in that next session. But they're there, mostly unchanged. And even mindfulness, when you become really present to how you're feeling emotionally. I've done that morning, noon, and night because my emotions would come back with such intensity as a result of going through a really traumatic experience. And I actually sat with my emotions 3, sometimes more, times a day for over 6 months. And it didn't really change that intensity of the emotion, but that's okay. That's what my practice was. It was just being mindful. But if you're finding it very difficult to be with those emotions, just add hypnosis to whatever it is you're doing. So there's a new mindset that I bring to my hypnotherapy sessions with my clients, that we can resolve their pain, whether it's physical or emotional pain, in one session. And that mindset is everything, because that's what hypnosis is all about. It's giving you choices, so that the only choice isn't to do long, drawn-out sessions over months or years. So I'll never tell you that your time is up and we'll continue next week, or send you away in pain before we've actually fixed the problem. Because I do this testing at the end of my sessions, because the client has come in with a certain problem. And at the end of the session, I test and ask them how they feel about their problem. And if they still have an issue with their problem, if they're still feeling pain, if they're still feeling that physical or emotional pain, then that means the session isn't over yet, that they have to do a little bit more work, that their subconscious mind can do a little bit more work. And this is why I focus on results, not on sessions.